Burning, tingling, numbness in both feet or hands, pain when touching the skin in these areas. The sensations affect both sides symmetrically, like when using tight socks or gloves. These are common symptoms of peripheral polyneuropathy. Today, I will explain what this condition is, what are the symptoms that cause peripheral polyneuropathy, and how to treat it. So, let's talk today about peripheral polyneuropathy. Our body has a neurological system that is composed of the central and peripheral nervous systems. The central nervous system is what is inside the skull and vertebra, which are the brain and the spinal cord. Everything that exits is the peripheral nervous system, and it's composed of the nerves. The nerves have long neurons, and the nucleus or central part of these neurons are close to the spine. Some neurons are very long. They exit the spine in the lumbar area and they travel all the way to the toes. The nutrition of the neurons is carried inside, and they have to travel all the way from the nucleus to the tip of the nerve. So the tips of the nerves can be affected by a variety of conditions, as they are far away from the nucleus. These conditions usually start in the periphery and progressively spread upwards. The longer nerves of the legs are affected first, and then the longer nerves of the hands can also be affected. So the person develops symptoms in a distribution that we call socks and gloves. But the feet and hands are not the only parts affected. The person may also have other symptoms, including muscle weakness, lack of balance, frequent falls, and the nerves that control the internal organs can also be affected, therefore affecting functions of the digestion, heart rate, blood pressure, bladder, and bowels. What causes peripheral polyneuropathy? In most cases, we can't find the cause of the problem, and we say this is an idiopathic peripheral polyneuropathy. Idiopathic means we don't know the cause. In other cases, it might be related to low vitamin levels, usually B1, B6, or B12, as well as copper and vitamin E. It can also be due to diabetes, or excessive use of alcohol, exposures to toxic substances, or certain treatments for cancer. How can peripheral polyneuropathy be treated? Well, before I continue, let me remind you that this video is not intended to provide medical advice. It is for educational purposes only. If you think you have a problem with peripheral neuropathy, please talk to your doctor. If there is an emergency, please go to the nearest emergency department or call an ambulance. First, if the cause of the problem is identified, it's important to avoid or correct the problem. If it was a deficiency of vitamin, then the person needs to correct that deficiency. If it was too much ingestion of alcohol, then they need to quit drinking. In case of diabetes, the person needs to have a good control of their blood sugars to avoid more damage to the neurons. In all cases of peripheral polyneuropathy, the person can improve their symptoms by adopting a healthy lifestyle. This includes a healthy diet, exercises regularly, be exposed to sunlight, which helps to produce vitamin D and melatonin, make sure they adhere to good sleep habits, maintain a healthy weight, and avoid smoking and alcohol, which predisposes to nerve damage. Second, if the person needs to take medications to improve the pain, we recommend the person to use medications for neuropathic pain. I have another video that I explain what neuropathic pain is. But in summary, the medications include drugs in the class of antidepressants, antiepileptics, cannabinoids, and opioids. The person will need to take these medications for a prolonged period before they see some benefits, and most likely they will be on these medications for the rest of their lives. Third, the person may try some supplements to see if they feel better. One of these is alpha-lipoic acid, or ALA. It's usually well tolerated, but in some people it may cause headaches, nausea, vomiting, and heartburn. The recommended doses are between 600 and 1800 milligrams daily for up to 6 months. ALA can also be found in foods like red meat, carrots, beets, spinach, broccoli, and potatoes. Fourth, it is important that the person be aware of stressors, fears, worries, and anxiety, as these conditions may aggravate the sensations of pain. They are like amplifiers of pain. In this case, the person will benefit from psychotherapy to help them deal with these emotions and thoughts, and their pain intensity may drastically be reduced. Don't forget to subscribe to this channel, as I always post new videos here and to help people with chronic pain. So if you have these symptoms, talk to your doctor as soon as possible. Now, if you are a doctor, I'd like to give you a copy of this handout. I use this to teach my residents about the difference between neuropathic and nociplastic pain. You can download it for free. The link is in this video's description below. And thank you for watching. Bye!